Hello guys, and welcome to my YouTube channel. Okay, in today's video I will be talking about pregnancy induced hypertension. Okay, so hypertension present in pregnancy. All right, so before I proceed, I would like to request that you click on the subscribe button and hit the notification button so you get notified of my videos. All right, this pregnancy-induced hypertension is a very crucial topic, is a very crucial matter that needs to be discussed, and awareness needs to be created as you venture into conception during the pregnancy period to delivery. Okay, something that we need to talk about to gain better knowledge on it so as to ensure that you would have a safe conception and wonderful and healthy baby. All right, so we have the table of contents. The table of contents is actually a lot, okay, with lots of sub-headings, and I would encourage you to subscribe because I would have this table of content discussed in segments, 2 segments, because this is because if I do have all of this subtopic discussed in just one video, it would be a lot, and that is not what we want because it won't aid better understanding. All right, so do subscribe and hit the notification button to help you understand what would be discussed and how to better prepare yourself and manage yourself from high blood pressure in pregnancy. All right, and also as this video will be going on, if you have any question, if you have any comment, just leave it at the comment section. I will be going through and I would respond to each of it. Good. All right, so the table of content, we have what is blood pressure, what is high blood pressure, how is high blood pressure different from high blood pressure at other times, yeah? And then the different forms of hypertension in pregnancy, people at risk of developing high blood pressure in pregnancy, signs and symptoms, dangers of hypertension during pregnancy, management of high blood pressure in pregnancy, possible steps to take to ensure safe delivery in hypertension in pregnancy, prevention and prognosis. I also have other subtopics that I haven't listed here, so just stay tuned, stay glued, watch to the end of the video so you won't miss out any vital point. Okay, yes. All right, so before we proceed, I'd like to apologize for the background noise that you would be hearing. I'm actually making this video close to the bus park, so you just bear with me, listen to my voice, and look at the slides. All right, so let's proceed. So what is blood pressure? Yes, so now we know what blood looks like. We know what blood is. We know what the heart looks like and what the heart does. But what is the blood pressure there? So we have flow of blood from the heart to the various parts of the body via the blood vessels. But how does this happen? And what causes the blood to flow? This is because the heart pumps out blood. Now, the pressure that the heart uses to pump out the blood is the same pressure that the blood now uses to flow through the blood vessels. The pressure exerted on the walls of the blood vessel is what is termed blood pressure. Okay, so when there is increased pressure on the walls of the vessels, okay, that is now the term referred to as high blood pressure. So this is where the term comes in as high blood pressure, okay? And it is really vital that we know when someone is beginning to have high blood pressure and how to prevent it. Now, I won't be talking much about high blood pressure in general because it's not the topic of concern for today. So we will just proceed next to high blood pressure in pregnancy. This is a very important topic, like I said before, because it causes lots of deformities, disorders, even stillbirths of the newborn. It might even lead to a woman having lots of complication. It has been reported in some cases of women losing not just the child, but also losing their uterus, which is the womb, okay? and even death in some cases. So we say it's really important that we know what this is, try to prevent it and manage it in cases of those that are already present with it. All right. So then the next thing we will talk about is different forms of hypertension in pregnancy. All right. Now, high blood pressure complicates about 12% of all pregnancies. Yes, you heard me right. 12% of all pregnancies. And there are different and several types of high blood pressure during pregnancy. These types vary in severity and impact that they have on the body. Okay, so I'll be explaining each of them. We have about 4 listed out here. We have the chronic hypertension. We have the chronic hypertension with superimposed preeclampsia, okay, which is the preeclampsia which develops in someone who has chronic hypertension. I will talk about that. Just hold on. And then next we have the gestational hypertension. Lastly, we have the preeclampsia. Okay, now the first point listed here, which is the chronic hypertension, the first item. Okay, chronic hypertension. This is usually a woman who has a history of hypertension before pregnancy. Okay, so the hypertension she is presenting with during pregnancy is a hypertension that she has had even before getting pregnant, which is why it's important to protect ourselves from coming down with hypertension, because it would affect us in most of our daily activities and lifestyle. Yes. And then next we have the chronic hypertension with superimposed preeclampsia. Yeah. So chronic hypertension is already there. Like I mentioned before and explained that this is someone that already has hypertension before getting pregnant and is now presenting with hypertension during pregnancy. Now, but in the case where there is also presence of preeclampsia, this usually would happen and come up at the second phase of pregnancy, more like the second trimester of pregnancy. But the only reason why this one is termed to chronic hypertension alongside preeclampsia, this is because the preeclampsia here, okay, is present different on its own, as well as the chronic hypertension being already present. The preeclampsia here does not necessarily present with all of this edema and proteinuria, which is associated with preeclampsia. It happens much later. Okay, yes. And then we have the gestational hypertension. Gestational hypertension is one that happens at the latter phase of pregnancy. In some women, it happens at the 3rd trimester. For some people, it happens at the 2nd trimester. But in all of this, it's something that just happens with just indication of increased high blood pressure. And that's the only symptom that is present, just high blood pressure. Proteinuria is usually not present. There is no edema, which is the swelling of the legs and probably the hands. Okay, so in this case of gestational hypertension, there is none. Okay, and this one is just generally caused by pregnancy. Okay, towards the ending part of the pregnancy. It usually goes off right after delivery. If it doesn't go off right after delivery, you might need to consult with your gynecologist. And lastly, we have the preeclampsia. Preeclampsia usually develops at the 2nd trimester of the pregnancy. The preeclampsia is usually presenting with proteinuria, which is protein in the urine, and also edema around the legs, the ankle side. Okay, so protein and the edema. When you see the protein urine, edema in a woman who's pregnant, as well as significantly high blood pressure, then we know that this woman is presenting with preeclampsia and an emergency should be considered for her. Okay, so that's that for the 4 forms of hypertension in pregnancy. All right, and now let's move on to the next slide, okay, which is people at risk of developing high blood pressure in pregnancy. Yes, so before we proceed, I needed to understand that high blood pressure in pregnancy, okay, already is a risk that most women pregnant come down with, okay? So almost every woman is at risk of developing high blood pressure in pregnancy. But I have listed out some that are at more higher risk of developing hypertension in pregnancy. Right. So you just listen and go through the slide with me. We have the first one is a woman under the age of 20 or a woman who is above 40 years of age. Okay, so age is a very, very crucial factor when considering childbirth, conception, and all that. Okay, now next is a history of chronic hypertension. I mentioned in the previous slide chronic hypertension is a woman who already has hypertension in the previous before getting pregnant, being at risk of coming down with hypertension in pregnancy. Okay, so we see that someone that already has hypertension is at risk of coming down with hypertension when she becomes pregnant. Yeah, good. Now, the next one again is someone that has had gestational hypertension or preeclampsia during the past pregnancy. Yeah, so this is about history now. If a woman has had gestational hypertension or preeclampsia during the past pregnancies, there is every tendency of her coming down with yet another hypertension in the subsequent pregnancies. Okay. Now, a woman who has family history of gestational hypertension, yeah, someone with family history of gestational hypertension is also at a very high risk of coming down with hypertension in pregnancy. Now, the family history we're talking about must not necessarily mean the woman herself. It could be from her mother, from the grandmother, the father, the aunt, but just the family member who has had gestational hypertension. Did I mention the father? Oops, no, it shouldn't be the father. It should be the mother, the aunt, or the sisters, right? All right, and next we have someone who has diabetes or gestational diabetes. Yeah, so if you have diabetes before getting pregnant, you are at risk of coming down with hypertension. Now, these are people at risk of coming down with hypertension in pregnancy, but they are not yet with the hypertension yet, but they can actually be managed, right? So that's why we mention them, right? Then we have the overweight. This is almost close to coming down with diabetes or having diabetes rather. So if you're being overweight, you need to start thinking of working on the weight before you think about getting pregnant, as it would help you prevent high blood pressure in pregnancy with the complication that comes with that. And then next we have a woman who has an immune system disorder, such as lupus. Okay, your immune system should not be too low and it should not be too high. It should just be normal as to ensure the active functioning of all the organs of the body. And then we have the kidney disease. Someone who is down with a kidney disease, a woman who has a history of kidney disease is most likely to come down with hypertension in pregnancy. This is because the kidney is mostly known as the powerhouse of filtering of the blood. So if the kidney is having a problem, then of course it would not be so efficient in filtering the blood, thereby making lots of workload on the blood vessels and on the heart, thereby increasing the blood pressure. See how it works? Yeah. Then the next part is a woman who is expecting multiple babies. For a woman who is expecting multiple babies, this is a woman, okay? One human being with just one heart that has to supply multiple babies' blood. So definitely there will be increased blood pressure. There is no two ways about it, but it actually can be managed and controlled to ensure the safety of the mother and the babies. Yep. And then a woman who has had in vitro fertilization, okay? I'll be talking about this in vitro fertilization in a subsequent video, okay? So you just stay, that's why you need to subscribe to the channel so you can learn what it is. Yeah, we'll talk about it. All right, so usually we would suggest that for everyone mentioned under this category, should be actually closely monitored by the gynecologist, which is why we encourage mothers to always consult with the gynecologist as soon as conception has been noticed. Yeah. And finally, the last part of the video, I will be talking about a chart, all right, to show you what the normal blood pressure should be and what the high blood pressure should be, the way it looks like from the first stage, the second stage, and the severely high hypertension stage. Yeah. So we have normal. Under the normal, it is considered that blood pressure should not be above 120 for the systolic, which is the high number figure we see when we check our blood pressure. Okay. And then it should also not be less than 80. Okay. It shouldn't be less than 80. It shouldn't be above 80. No, not good. Begins to raise alarm for the diastolic. And then we consider high blood pressure to be slightly elevated when our systolic ranges between 120 to 129 millimeter mercury. Okay. And for the diastolic, when it is less than 80. Okay. And then we consider it to be high blood pressure stage 1 when our systolic is ranging between 130 to 139 millimeter mercury, and our diastolic would be ranging from 80 to 89 millimeter mercury. Then for the second stage, okay, of high blood pressure, we consider the systolic to be 140 or higher, and our diastolic to be 90 or higher. Okay, so when we see a condition like this, we know that it's time to rush to the hospital. Then the hypertensive crisis, that's the severely high. Okay, we consider the systolic to be higher than 180 millimeter mercury and the diastolic to be higher than 120 millimeter mercury. Okay, so we see the changes, the way it goes. So when you notice that your blood pressure doesn't fall within this or falls within this range, definitely should fall within this range. Now you're able to know when to visit your hospital, see your doctor, and what you should do. In my next video, I'll be talking about other things that we need to do, nutrients to take, the kind of food to take to protect the pregnant mother, as that's a topic that concerns us. Okay, how to protect the pregnant mother and her child to ensure that she is able to manage hypertension in pregnancy if eventually she comes down with it, and how to prevent it, before conception, right? If you haven't subscribed to my YouTube channel, please do want to subscribe to my YouTube channel. Hit the notification button. Please leave a thumbs up, as this would encourage me. And then also leave a comment, and I will be going through the comments to respond to your questions, your concerns, and your suggestions. Okay? All right, now I will be seeing you in my next video. Bye.